My name's Alex Scott. I'm the branch secretary of the Together branch, and today is the September public service briefing, which is one of our monthly sessions to try and provide members with up-to-date information is what's happening in an industrial sense across the public sector. But before we start, I'd just like to acknowledge the traditional owners on the land that we're meeting across the state today and acknowledge the leaders past, present and emerging. In terms of today, we did distribute the notice today in relation to what people were wanting to seek. And so clearly one of the major issues for today has been in relation to COVID and also in relation to return to office and the Public Service Act. But we will try and spend more time talking about the areas where we had the most questions, and that's in relation to COVID vaccinations, where we're at, where we're likely to be, and what's going to happen in the public service. In terms of this, this is new ground in relation to industrial relations. So we will try and provide you with my best estimate of what is the situation now and give you some predictions, which are only predictions in relation to what is likely to be the conversation over in the near future in relation to COVID vaccination process. So in terms of today, we will be primarily focusing on what COVID means in relation to the vaccination process for the Queensland Public Service. We have a very broad range of members, both in the public and the private sector. So today we will try to give you accurate information for the public service. It does vary a bit, particularly in parts of the police service and Queensland Health, but we won't be focusing too much in relation to what it means for the private sector. In terms of that, what we are looking at, and we kind of want to put this into context, is the kind of broader response in relation to COVID has been about trying to flatten the curve. And this was talked about a lot in terms of 2020, particularly at the beginning of the year, given that Queensland did so well in terms of its response to COVID, that the graph was talked about less in the second half of the year. And I think then in the next, in terms of 2022, I think then the real question is what is the government's response at a state and a federal level in relation to whether we're seeking to eliminate COVID or whether seeking to deal with COVID, but also in a critical sense as to whether or not we're seeking to try and limit the impact of COVID to the extent, A, to reduce deaths within the community, but also to reduce the impact on the community. And a critical point, though, is the issue of the capacity of the healthcare system. And while it's not particularly a problem in Queensland at the moment, our health system is under stress because it's under stress for a range of reasons. But I think there is going to have to be a conversation when they talk about the 70 and 80% mark in terms of vaccinations about what that potentially means in relation to the capacity of the health system to cope. Because as we do look at unlocking either our borders or our internal systems, that will see an increase in COVID numbers. And that will be critical in relation to what it means for the community, but also critical in relation to if COVID numbers increase, are we able to manage that within our healthcare system? And I think that is going to be a conversation that we need to have moving forward, particularly looking at what's happening in New South Wales with the breakout numbers there, but also the conversation in Western Australia and Queensland, which have had greater success. But what does this look like in terms of if there is a proposal to start releasing borders and opening up? Have we actually got a healthcare system that is capable of managing a surge? Because as we unlock, there is going to be an increasing number of COVID cases on what that looks like. I think also in terms of the conversation in an industrial sense is the return to office piece. And certainly we're having that conversation with government, and we had that, we'll talk about a little bit about that later. But certainly I think in terms of the science around COVID, looking at the implications of the new strains of COVID, particularly the Delta strain, has been the question about what that means in terms of transmission and what that means in terms of the ability to return to the office and the kind of 1.5 distance rule. And that is going to be an ongoing conversation. But we know, irrespective of what we're doing about borders, irrespective of what we're doing about the system in relation to social distancing, that vaccinations are part of the conversation moving forward. Whether vaccinations are going to be capable of eliminating COVID, I think is highly unlikely. But the key question, I think, over the next few months is going to be in relation to the vaccination process, the question about, is it possible and is it appropriate for my employer or your employer to make it mandated? So in terms of, we'll come to that conversation as we go through the presentation, but clearly that is a key conversation that we will be having to have as a union with your employers across the public service in the short to medium term. In terms of vaccinations, that question is a little bit hypothetical at the moment because there is a lack of supply. And it's realistically impossible for your employer to mandate vaccinations if they're not available to you. So if the government in some form mandated everybody having to be vaccinated by tomorrow, that's not practically possible because of the shortage of vaccines and the slow rollout that's occurred across the country in relation to vaccination rates. So the question about mandation really becomes more of an issue once the supply issue has been dealt with. And at the moment, then thinking about what that looks like in terms of vulnerable workers and those people who on the medical evidence should not be vaccinated. And then I think the third element is going to be the question in relation to mandate, whether they should be mandated. So what that means, I think, for us in terms of the Queensland Public Service is going to be, first of all, increasing the capacity in terms of vaccinations. And what we will see over the next few months is that those people who are voluntarily being vaccinated are increasing. And slowly everybody, sometime between now and Christmas, we should be at the stage where everybody who wants to be vaccinated has been able to be vaccinated. We are well short of that at the moment, but as the vaccine gets rolled out, it is a straight mathematical exercise. Every person who gets a jab will increase the number of people in the community in terms of that process. I'll be talking about return to office a little bit in more detail about vulnerable workers, but at the moment, what we're really talking about is the vaccine part. In terms of that, the vaccine will be available, and sometime between now and Christmas, we will hit a point where those people who want to be vaccinated have been able to be vaccinated. I think also as we get to that point, it's likely that the definition of who it's available to will increase, partly based on the COVID science around transmissibility. But one of the reasons, there's two elements to vaccinations. One is about trying to make sure those people who are vaccinated have the full medical support in relation to, if you're vaccinated, you are less likely to get it, but you're also less likely to get as sick, and you are less likely to transmit it to others. I think there will be a definitional question that will be coming up over the next period is in relation to younger people, about how young that science question operates in relation to whether at what point younger people should be vaccinated, either for themselves or in relation to the term of herd immunity. And those things I think will be being issued through the National Cabinet or the health directives. But once we've got to the point where everybody who wants to be vaccinated can be vaccinated, then we're going to get into the point of how does the community move to a higher level. And there'll be some people who want to get vaccinated. There'll be some people who may or may not get vaccinated, and some people who shouldn't be vaccinated, and some people who are going to refuse to get vaccinated. In terms of that space, once we've got to the point where everybody who voluntarily has been vaccinated, then we'll get to the point about what incentives or measures might be put in place in relation to increasing that number, because what we know is Queensland is probably at the lower end, both in terms of the rollout, but also with the percentage of the population who are interested in being vaccinated. And I think the figures in the Murdoch press this week was talking about 25 to 30% of the Queensland community potentially either opposing it or being hesitant in that space. And if you have 30% of the community unwilling to be vaccinated, you're not going to get past 70%, no matter how you define that 70%. So in terms of that, then there will be three elements potentially in this space, and this is where we're going to start talking about hypotheticals rather than practicals. But there is the ability for health mandates to be issued, directives to be issued, those things which are issued by the CHO, and she has very significant powers, the Chief Health Officer, to do, so that she issues the directive in relation to lockdown, in relation to masks and whatever. But there's also then the question about whether there is employer-determined mandates and whether there is legislative-determined mandates. In terms of that process, what we're looking at from a union perspective, From a broader point of view, the union policy is that we are supportive of the science, that we know that the Queensland government has done well with CHO, and Queensland Health has done a great job in terms of developing our response to COVID. And we think that vaccinations, we take the advice from the medical professionals, from the scientists, and we support vaccinations as being part of the solution in relation to COVID, just as they are also part of the solution in relation to so many other health issues that we've faced in the community over a long period of time. So from that point of view, we are unequivocal in our position that vaccinations are good, and we will be encouraging people to be vaccinated because we think that is good in their long-term benefit for them as individuals, but also good for the community if we have the less people the more people are vaccinated, the closer we will get to herd immunity. So from that point of view, our view is that we will be saying to people that you should be considering being vaccinated. Beyond that, in terms of then the paradigm that fits about where we're likely to go, our union continues to support health directives. We believe that we should be following that science. So in terms of the question about lockdowns, the question about masks, the questions about social distancing, we think that those things are health decisions and should be taken out of politics. We're lucky in terms of Queensland that the legislation enables the CHO to make most of these decisions rather than being political decisions. But in terms of that process, our union will continue to support the CHO and the health system in doing whatever they need to in terms of health directives, and we're telling members that if there's a lockdown, you've got to follow the lockdown. If there's mask requirements, you've got to follow the mask requirements. And in terms of that, that really is going back to the broader position from last year about the CHO and the health system making decisions about trying to eliminate COVID, but also where COVID does exist, reduce the spread and making sure that we can flatten the curve that was talked about last year. So that's why we support vaccinations, because we think it's part of that process. What is going to be a critical issue for workers and the community over the next few months is going to be about whether they should then become mandatory and whether the employer should be able to decide that you should be required to be vaccinated as part of their response to COVID. So our view is that the CHO should be able to make health directives, and we support that. But in terms of whether or not the employer should be able to make decisions, that is quite clearly a different situation. So in terms of that, the question is, we support health directives, but we don't think there will be health directives issued by the CHO to say that there will be mandating. There may be directives by the Director General of Health for health workers in relation to mandating, but that is an employer mandate. It's not a health directive, and that is quite a significant difference, because the same issue would apply in Queensland Police, that there is the ability for the CHO is unlikely to issue a directive to say that the police service are required to be mandated, but there is the potential that under their act that the police commissioner might make mandates, and that's something that is a live conversation. And I think that also then becomes an issue for public sector workers because there is the ability and a conversation to be had, particularly in the federal jurisdiction, about whether Qantas or private sector employers can mandate, and that is unclear. And that is going to be an issue that is going to have to be resolved through case law over a period of time, because there isn't legislation that currently exists to say what is or isn't reasonable. And that will then be determined on a case-by-case basis, as with any common law piece. And that is likely to then have precedent set, and then the courts will determine that, and the industrial tribunals will determine that as it moves forward. And it's likely that those federal decisions will become earlier than the state decisions. We have a different industrial system in Queensland compared to the private sector and the federal Commonwealth, and there's a Fair Work jurisdiction versus the State Industrial Relations Act. So it's likely that the decisions will come out of the Fair Work Act first, and then will be dealt with by, but they will have strong precedent value, and it's likely the State Industrial Relations Commission will adopt similar outcomes to decisions made by the Fair Work Commission or the federal tribunals or federal processes. So that is an area that is subject to lack of clarity at the moment, but over the next few months, we would expect to see decisions being handed down by the courts in this regard. and we will be, I think in terms of that, we think that it is likely that the courts are going, this isn't part of the slide, but we don't want to put this in writing. We think that given some of the recent decisions about flu vaccines, there will be an element to the reasonableness of those decisions where I think the employer will have some rights, but it'll come down to the reasonableness, just in the same way that some of the court challenges by Clive Palmer around borders will come down to the reasonableness in that space. And then there's going to be a third element for Queensland, for the public service in particular, because we are uniquely employed, as to whether or not the employer has the ability to set the law. They can do that through legislation, they can do that through delegated legislation, but some employers in the public sector have far greater power than private sector employers, particularly in the health system and the police service, but also in the public service through Public Service Commission directives. Those directives potentially could wipe out any decisions that are made by the tribunals and would set the framework for tribunal decisions in the future, rather than the common law alone establishing. And that's why we're saying today's briefing is about the public service rather than our private sector members, because the private sector members will deal with the health directives and the tribunal decisions. The public service has an overreaching piece that will work on that. Broadly, in terms of what is reasonable for workers, what we are seeing and what we would expect to continue to see is that the employer can pick and choose what they say is the minimum requirements for someone to do the job. So we're already seeing in parts of health, and we would expect to see increasingly in the public sector and in the private sector, a requirement that if you're going to start a new job, that the position with the description might say you need a driver's license, but might also say you need to be COVID vaccinated. And the employer has extreme power in this regard because they're choosing who they have. So the ability to stop the employer requiring vaccinations for new employees is very limited. There is another piece, though, no matter what piece of legislation they use or whether they use the common law, will be the issue about vulnerable workers and making sure that even if they want to mandate for all workers to have it, there is going to be a percentage of the workforce who have underlying medical conditions and strong medical reasons that make it that the vaccination is worse for them than not being vaccinated, but also the support for herd immunity is overridden because of their unique medical circumstances. And so there will be a piece around vulnerable workers, and we will be having to work with those people in those circumstances as the law develops to ensure that they're fully protected. In the same way we need to protect them about return to office, the same conversation will need to happen in relation to if there is a mandating within their workforce. But then the last piece then comes down to the ability of the employer to change your employment conditions to make it one where you are required to be vaccinated. And that's where the existing workforce has more rights than new employees, has different rights to vulnerable workers. And what we are looking at from a union perspective is that while we are broadly supportive of the issue of vaccinations and encouraging people to vaccinate, whether it should be applied as a mandated issue, we think is very different in the health context versus the kind of disabilities context versus corrections, schools, but also then into the kind of 1 William Street style public service. And the reasonableness of mandating vaccinations is something that we think members should be deciding. First of all, we don't think the employer should have the unilateral right to do that, but we also, from a practical perspective, recognise that there is legislation that is in place in terms of the Health Act and the Police Act and other pieces of public sector legislation that mean the employer can use that legislation if they wish to mandate legislation. And we've certainly seen that. We're close to that. We think in the health service, they've already mandated certain areas of the health service have to have vaccinations. What that means, and that's an ongoing conversation that is going to now apply to aged care. And we think over the next few months, where the line is drawn in health has yet to be decided, but that line will expand over time. We're also in that conversation with the police service. It looks highly likely, I would think, that the sworn staff within police, sworn officers are likely to be vaccinated, but whether that applies to public servants in police hasn't yet been determined, and we are working that through with the employer. But we think that the question about whether we are fundamentally opposed to mandating in the police service or in other employers, we think is a decision that members in those departments and those agencies should be making. just as you make the decision about what the enterprise bargaining looks like, what our claims look like, our view is that you should also be the ones making the decision about whether you think it's reasonable, and some groups of members may determine that it's reasonable that their employer as a collective, that you make a decision that's reasonable to support mandating. Others may say you're opposed to it. That is becoming a policy question rather than a practical question, because we think in large part the public sector has the ability to be enforced, and clearly as a unicameral system there is also some threats, well not threats, there is some realities that if we win court cases, Queensland public servants can have their enterprise bargaining rights overturned at the last minute, as we saw with the wage deferral last year. There is risks in relation to public sector workers looking at it in terms of potential legislation. While we have subordinate legislation in place in police and in health, and potentially through public service commission directives, there is still further risks around mandation through legislation. We haven't seen that. There's been no suggestion that's going to come, but in an industrial briefing, there is likely that will occur. And that means our strategy in the public sector has to be different to our strategy in the private sector, where there isn't those tools available to the employer. And what happens in Qantas and Virgin and our other private sector members, our strategies are going to be different there to what our strategies look like in the public sector. So that's really where we're at with the COVID conversation. We are continuing to support the health directives. We are supportive of vaccinations as a question. We would encourage people to get vaccinated. Where the question about mandating fits, I think, is going to be a moving feast over the next few months. It is going to become more of an issue the closer we get to higher vaccination rates. But we need to then work with members to work out what our policy is in relation to that. But we'd also have to say, as public sector workers, there is a series of things your employer can do in relation to legislation and subordinate legislation that doesn't apply in the private sector. And so we'll have to have a different strategy about working that through. But once again, no matter what law is applied or created, either subordinate or otherwise, we'll be working with vulnerable workers to make sure that your individual situations are protected. In terms of the other processes that we wanted to cover today, we had, with the report back on the Consultative Forum in July, we talked about at the August meeting, the return to office process. There's negotiations occurring next week with the agencies, and we have now stepped that with a group of agencies centrally to work through what an alternative industrial environment looks like. And so we certainly have had a breakthrough on that. We haven't got an outcome on that, but the negotiations now are live in terms of looking at better ways to regulate and protect your rights and entitlements in a creation of a 2022 version of work, as opposed to reverting back to a 2019 version of work. So that we were hoping to have that meeting before today, but that meeting I think has been scheduled for next Wednesday, and we'll continue to report back to people on that. In terms of the Public Service Act review, that now has been, the Joint Advisory Committee met yesterday and has agreed to pick up the issues we reported back at the last meeting to talk through in relation to the Public Service Act review. And in terms of that, particularly the kind of key issues in relation to scope, governance, employment rights and equity, I think we have made significant progress. That is still on track for legislation next year. But I think in terms of that, the key areas that are still subject to discussion is we haven't seen the outcome of the review of the stage 1 reforms from last year. But I think what that will look like is we are going to see significant improvements in relation to the conversion rights, but we need to work out what hasn't worked as much as what has worked in relation to the stage 1 reforms. And also then independently but concurrently with the review of the Public Service Act has been the issue in relation to the review of recruitment and selection processes. That review is due about now. But I think in terms of that review, we're expecting the government to come back and the Public Service Commission to come back and say things are going well. But I think what we'll be wanting to then do is escalate a separate conversation with the CCC around appointment processes and official misconduct, because we're continuing to see a concerning overlap by the CCC in relation to kind of charging public servants with fraud when they haven't been necessarily charged through other processes in relation to some sick leave for school teachers. But in terms of that process, we need to get clarity about where the CCC fits in terms of official misconduct versus the Public Service Act processes. But I think that also then overlaps in terms of the question about how do we keep recruitment and selection processes honest and transparent in relation to those processes. And I think we would be wanting to think about that process and see what people's view are in relation to where you think the public service is at in relation to recruitment processes, whether you think this is something that we should be pursuing. So in terms of that, I think this is a bit kind of hit and miss on some agencies, but we are keen to get your feedback about whether we should be prosecuting an alternative process in relation to the keeping the processes around recruitment and selection open and honest. So I think what that looks like, I think we have had strong support in terms of that. And I think the other part will be, we will then be looking at the, then in terms of the other processes, we have the review of the Public Service Act that is still ongoing. I think that is going to deal hopefully with the overlap between the question of where sexual harassment fits and where workplace bullying fits, which I talked about at some length in the last Zoom. But I think hopefully we think that is still on track, but we haven't seen final outcomes. But I think there is also a question about whether the Industrial Relations Act will potentially be a little bit slower than the Public Service Act. I think then in terms of the other major activity that the union is doing is also in relation to the wages. So the wages will be being paid that we did we had the extended enterprise bargaining process that ended up in the arbitration process last year. And then we ended up with a resolution this year. We understand from shared services that most public servants should be getting that pay next week in their pay packets, which will be a 2.5% increase. But clearly in terms of that, as part of the settlement, we've moved not only to getting that 2.5%, but we've also, as part of that settlement, we picked up a 2.5% a payment in March next year for public servants in March. In transport, it's 1 January. But we're able to do that in the settlements for the education and core agreements, even though we had a pay rise last year. Kind of 1.75, we were able to then get the double pay, and we didn't have a wage freeze for public servants and education members last year. We were able to get that negotiated to being a double payment this year. So what we will be looking at doing in terms of that process is also then thinking about how do we communicate both to members and non-members around the fact that while you're getting a 2.5% increase in terms of this year's pay increase, we're also wanting to think about how we can then talk about what the success of that settlement looks like and talk about where wages go next year, because we've got to start bargaining for education and transport next year and the core in 2023. So in terms of that process, we are looking at how that works. I'm sorry if I've spoken a little bit too fast today, but we were trying to fit in as much as we could in terms of the vaccination process. I know this is going to be a difficult issue moving forward, and we are going to try and work as closely as we can with everybody in that process. We will be continuing to have these Zooms on a monthly basis. The next one of those will be in the first week of October, so we will send out a follow-up email today to people giving you the details of that next Zoom and asking for your feedback out of how today went. We will also be trying to talk to, particularly in police and health, members in relation to where those conversations have got to, particularly in police, because we think that's going to be sooner rather than later. And then in relation to the broader conversation around what mandating does or doesn't look like, we will be talking about for that. But also, I think in terms of the COVID response, we'll be looking at potentially looking about whether we should be moving some of the issues around the COVID leave that was well supported by members as a claim into an industrial forum, and looking at that being a future award or EV component. So sorry for speaking a little bit faster today. We did try and slow down last month, but we're trying to get the timing right. But in terms of COVID, hopefully we've been able to explain what we know, what we don't know, and where we guess we're going in that process, and we will try and do that. If we haven't been able to get to your questions today, or we didn't cover the questions that we covered that were listed before the meeting today, if you could include those in the follow-up email that will come out this afternoon to make sure that everybody's questions do get answered, but certainly do provide your feedback, because we try and make sure that we listen to what you say about these meetings and we can make them better for the future. And we will be working directly with members in each department about what this looks like moving forward. So sorry for going a couple of minutes over time, but thanks for participating, and hopefully we will be able to keep you fully informed over the next couple of weeks. And hopefully I'll be able to talk to you again in early October to give you some meaningful movement in relation to the employment security issues and the Public Service Act processes. Thank you.